All right, begin now, please.
Okay. Hello, I'm Dr. Kamal Ibrahim. I'm one of the candidates for this exam. May I confirm I'm on to Mr. Mann, the vascular consultant?
Yes, Doctor. Dr. Mann here.
Oh,
Why did you call,
thank you,
Doctor?
Doctor. Thank you, Dr. Mann. I'm calling on behalf of a 64-year-old man who suspects is having acute limb ischemia.
Okay, Doctor.
Okay, thank you.
Summarize
Thank
your
you. Thank you. She's a 54-year-old woman who we admitted on diagnosis of mild diverticulitis and has been on management, which is has been improved on the management uh, with the use of the intravenous fluid and antibiotics. However, uh, just got an information that she's dealing with sudden acute and severe left lower limb pain. The investigations done so far includes ECG that shows atrial fibrillation with broad preventricular complex and a material blood gas that shows metabolic acidosis. Electrolyte creatinine shows hypokalemia. We also have done, she has also had arterial duplex that confirms acute limb ischemia. So I'm calling to inform you about this and for possible referral to your center.
Doctor, is it urgent? Can we wait for tomorrow?
It's actually urgent for the fear of losing her limb.
Okay. But she's having some cardiac problems. So do you need to have a review of the cardiologist first?
Yes, we'll need to have a cardiology review. However, she can have that while she's over there.
So you want to do the review first before transfer?
I would suggest
It's not clear, your answer. You have to elaborate.
probably her first, then hello?
Yes.
Hello?
Yeah, Mutin. Hello, any further question?
So what differential diagnosis
So
would you, yes, please.
yeah, what is your differential diagnosis?
You'll consider?
Considering the presentation of this patient, I think mild diverticulitis, acute mesenteric ischemia, perforated peptic ulcer disease, and acute cholecystitis, acute pancreatitis.
Okay, so what do you think of her presumed diagnosis of diverticulitis?
I think the patient probably has acute mesenteric ischemia, considering the acute limb ischemia we are entertaining at the moment, and with the result of ECG that shows atrial fibrillation.
Okay, doctor. Do you want to do the abdominal scan first?
At the moment, patient has no, the abdomen is lax. However, we'll do a serial examination and also to do serial abdominal ultrasound. But we need to probably need to refer first because the abdomen is quiet at the moment.
Okay. Could it be mesenteric ischemia?
Yes, very possible in the likes of the uh, atrial fibrillation that we have and the acute limb ischemia.
Okay. So for her, what imaging you will advise to do?
The patient has had arterial duplex, and this has actually confirmed the acute limb ischemia.
Okay. So what is your management plan for this patient?
Is to of course refer to the vascular surgeon for review and for possible either bypass surgery or to do ligation surgery, and also patient also need to placed on prophylactic to put on heparin, low molecular weight heparin, and also put on IV fluid.
Okay. Okay. So what will you tell her family?
I will inform the family that the patient has had a reduced blood flow to the left lower limb, and this needs an urgent attention for the fear of losing the left lower limb. And this, we don't have a vascular surgeon in our center, and this is why we need to refer to a center with a vascular surgeon.
Okay, so you will transfer in which type of ambulance?
We use ambulance that has adequate monitoring parameters.
Okay. What color will it be?
Blue color.
Okay, what equipments? Okay. So who will accompany the patient?
I might personally come together with the registrar ITU who accompany the patient.
Okay, doctor. You may transfer the patient.
Thank you, sir.
Thank
I
you.
appreciate.
Yes, my feedback was good, but there is still room for more improvement. When you describe the patient, so you have to describe exactly the symptoms, and you have to take the consultant towards the patient and patient's recent symptoms. You still had 1 minute left, but if you would have explained the plan of management, if you'll see the patient needs intravenous fluids and antibiotics, so you would have to monitor patient's output as well. So you would have to put the Foley's catheter. Then patient is also hypoxic, and patient is here. You can see patient is suffering from metabolic acidosis, and patient is hypokalemic. So you have to correct metabolic acidosis and hypokalemia as well. And then patient is also suffering from atrial fibrillation, so you have to manage that as well. And patient is also suffering from acute lung injury, because once you are talking about diverticulitis, now the next condition is that there could be mesenteric embolus. So in order to manage, or in order to do embolectomy, you have to keep in your mind all the conditions of the patient. So this you have to keep in your mind. You did mention anticoagulation, but then you have to tell exactly which anticoagulation would you give, and how would you Someone's headset is causing problem.